Hello! We are here to talk about an acute pain transfusion reaction, the widely unknown reaction. The predominant characteristic of this reaction is severe pain, either during or following the transfusion of blood products. This pain mainly occurs in the chest, back, or trunk, and this pain usually subsides when the transfusion is paused, but will quickly return if the same unit has resumed. Some patients only experience this pain in the limb where the transfusion is being administered. Other common characteristics are tachypnea, dyspnea, hypertension, chills, and tachycardia. These transfusion reactions are very uncommon. Overall, you have a 1% chance of any transfusion reaction, where in this 1%, there is an 8% chance of it being classified as an acute pain transfusion reaction. That gives a 0.0008% chance of all transfusions to have an acute pain transfusion reaction. To diagnose this type of transfusion reaction, it is basically based on the process of elimination. No single test or result gives a definite answer. After the reaction has presented itself, a workup is completed in the lab to search for any signs for a more severe reaction, for example, hemolysis or lipemia. This workup must be negative, have characteristics of an acute pain transfusion reaction, and show no other indications of one of the more common transfusion reactions. Only then, a pathologist has reviewed it, can it be classified as an acute pain transfusion reaction. The etiology of this transfusion reaction is unknown. 2 different studies suggest a possible correlation between the transfusion of pre-stored leukocyte-reduced blood products and the incidence of an acute pain transfusion reaction. These units have a filter that is used during the leukocyte reduction process, and researchers suspect that certain brands of these filters could be connected. These units also have the potential to have an increased number of cytokines, which could also play a part in the reaction. In the end, there's no straight answer as to why these reactions happen. Treatment of these reactions include stopping the transfusion, address the pain with medications, oxygen supplementation as needed, and emotional support as needed. There are still many unanswered questions when it comes to this type of transfusion reaction, and because it is poorly understood, it's important to be aware of this type of transfusion reaction to look for the signs. Even though this transfusion reaction is not as severe as others, it is still important to treat the transfusion as if it were life-threatening.